welcome to another episode of Mouth Matters with Dr. Dom. That's me, Domenic Lombardi, and I have a great guest today, Aaron Pisegna, lifelong friend, aka Cheese, aka a better golfer than I am.
I don't know about that, though.
So thank you so much for coming in today, fella.
Thanks for having me, though.
Means a lot. Means a lot. In this episode today, I kind of wanted to highlight what came in with a question from our Instagram follower, Steve. Steve wants to know what he can do to get a perfect smile, and he's heard about veneers, and he's heard about obviously braces and stuff, and he wants to know what's what. So basically, Steve, I look, and everyone else out there, I look at what your goals are, what your teeth look like now, and where we want to be.
Sure.
So I'm sure you've seen someone that has like just discolored teeth. Maybe they're crooked. It doesn't look right. Even if we do braces on someone like that, it doesn't necessarily mean that they're going to have a smile that they want. So a veneer, I'm sure you've heard of them.
Is that what it's made of? A veneer?
So it's a veneer. It describes like how you have like a wood veneer on like a wall or something like that. Yeah. So the veneers are made out of porcelain, and what we do, you can do them a couple different ways, but the way I do it is I trim down the tooth about a millimeter. About a millimeter in the front of the tooth. If you're just listening in and not seeing what I'm doing with my hands. It's basically that part of the tooth that you can see. So you take about a millimeter of that away, which, some people get a little freaked out about getting their teeth drilled on and all this stuff, but it truly is hard. It's not a structural integrity change. It's just giving us the room for that material.
I'm assuming that they're being numbed up.
Numbed up, yeah. So here's my rule. When I'm with a patient, I never use the word needle. But if I'm on screen and they're not in the office, I'm willing to talk about the needle and the shot. You need minimal numbing.
Are you putting them out?
No.
They're awake when this is happening?
No, you'll be awake. And the truth is that there's not a lot of sound effects other than the drill itself. And the cool thing is you come in that day, you get this done. You get some temporary ones that we make out of our temporary material. Some people use a composite. I use acrylic. They all work out. It's just to get you out the door and be able to function, smile and stuff while you're waiting on the permanent ones coming back from the lab. The lab I use is in California. It's called Aesthetic Porcelain Studios, and they do some of the most unbelievable work. And when you get the permanent, it's mind blowing, really.
But a customer, I guess, or a patient, I should say, the day they come in, they're actually still going to leave with something.
Oh, yeah.
Okay.
Yeah, you're leaving with some instant gratification.
Let me ask you this, Dr. Don. That's proud of you, by the way.
Yeah, thanks, brother.
Do you find your patients overwhelmed with emotion sometimes by what you've done? And if so, how does that affect you, or how does that touch you, I guess?
There's nothing better than seeing somebody feel better about themselves.
Sure.
Bottom line. And if that gives them the confidence to go talk to the person that they were too afraid to talk to go and get that job, to just actually smile and not inhibit their own emotions throughout the day. Like when she's out drives me, we want to see that big bright smile, which she isn't afraid to show.
Yeah, well, it doesn't come out much because I'm not out driving you anymore, Dom.
Do you mind if we share the story about the other night and when I maybe have failed to give you a putt that you thought you deserved?
Certainly.
This is gamesmanship at its finest, ladies and gentlemen.
Am I going to tell the story, or are you telling me?
You can tell it. I want you to tell it.
We're playing golf the other night, and good match. It was very close through 5 holes. Ends up being a 7-hole match. I'm 1 down.
Because it got dark.
6th hole, Sharon at Avalon Country Club, par 3. We both hit it over the green to the left. Let me set the mood per se, or it's dusk late by 8:45. We both hit incredible shots to the green. Dom had about 3 feet. I had about 5, maybe 6 feet.
7,
maybe 7. But of course, I give him his putt, and I say good, which to people that aren't golfers, they're just basically saying you're conceding that putt is good, and it's a nice gesture. Like I had told him, I can only refer to 1969 Ryder Cup, Jack Nicklaus and Tony Jacklin of Europe. On the last hole, Nicklaus makes his putt. Tony Jacklin has a putt. If he makes it, they tie, but America retains the cup. And if he misses, they actually lose straight up. So world class, Jack Nicklaus, Tony, it's good, pick it up. I don't want to see you miss. So it's kind of the flashback there, Dom.
Gentleman's game.
Gentleman's game, of course. Good, right? I want to see you putt it, Cheese. I kind of hesitated, trying to,
You were rattled.
I felt that, for it getting dark, time running out, to be one down going into the last hole was still just as good. Dormy won it. Dormy, if you will, which means Dom could not lose in regulation. But of course, he makes me putt it, and, like the packed, decent amateur golfer I am, I knocked it in the back.
I knew he was going to make it.
But we went on to play the last hole. I had a chance to tie, and I missed the putt, so I lost the match. But
the match was it was pretty high stakes. It was a $2 match.
$2 match, but again, deprived. The $2 might as well have been $1,000 because I wanted his $2 as much as he wanted my $2.
It's still sitting in my wallet. I hope you know that.
Well, I'll be hopefully, if the rain holds up, I'll be getting it back tonight. But yeah, it's like I said, I just remember that story about Jack Nicklaus and Tony Jacklin.
I not that it would be any consolation to my lack of character on the golf course, but I decided to get Aaron officially on Team Lombardi Dental with our official shirt here. So when he's wearing that shirt from now on, he's going to be receiving a lot of generosity on the golf course.
I'll be thinking about Dr. Lombardi and the putt he did not give me just a few days ago.
The cool thing, Cheese, bro, is like, we could joke all we want, but
sure.
Like, having the opportunity to be home, having the opportunity to reconnect,
absolutely,
with lifelong friends and everything, and it means so much to me. And I don't think that living anywhere else, I will feel the fulfillment I have in my life if I wasn't home.
I think I met Dom when Dom was a kid, early young teenager, about 13 years old. Played a golf league at Yankee Run over in Brookfield, Ohio. And Dom used to come out. I was probably, how old are you now, though?
I'm 28.
I'll be 37, so basically 8-9 years. So I was about 21, 22.
He was larger than life.
Still is. Full of confidence, and certainly didn't lack that. But Dom would come out. He lived near the course, and he'd come play with the big guys, and got to know him really well. And he just followed him through high school, college, and I don't believe they had a golf team in dental school, but I'm sure he would have been the one man.
We had a team of 3,
sure,
pretty much. But
from where he was to see him at 13, and to see where he's at now, golf course, but also off the golf course and in life, it's certainly nice to rekindle that friendship and that rivalry that I am not in any hurry to relinquish.
We'll be doing this till we're 80.
Yeah. I guess they say if you can walk, you can golf. So I certainly hope that we get to play golf for another 50 years. That would be nice.
The one thing I wanted to highlight is that Cheese's infectious humor and personality, and how it's so cool being around him. There's certain people in your life that when you're with them, you know that you're going to have a good time. For whatever it's worth.
For what that's worth, good or bad. That's a compliment for sure.
And kind of bringing in like a broad thought or whatever else is like. I think that when we're able to be most ourselves is when we're right inside, and when our health is right,
sure,
and everything. And I think that there's so many people out there who almost put their light under a lampshade, because they're ashamed, or And whether it's not, it doesn't have to be health or anything. It doesn't have to be dentistry. It could be any part of your life, your psyche. But I think that if we're able to smile, you know, and I know I'm being self-serving in this, but if we're able to smile, we're able to give that infectious laugh, that infectious personality without holding back.
I mean, I guess, you know, like I said, I appreciate the kind words, Dom. You know, I don't think any of us should take life too seriously per se. You know, it's you certainly should laugh every day if you have the opportunity. Sometimes it comes a little bit more naturally to some. I guess I have a quick wit per se. Dom is equally as funny. But I mean, you know, like Dom's saying, when you're with your friends, you know, that's when you're the most comfortable, and that's when you let your guard down. And
so,
you know,
so can I take, since we're with friends and we do let our guard down,
and he use that term loosely.
Can I, associates? Could I have a chance to ask you about what your at-home brushing habits are? What kind of mouth rinse you're using? What kind of toothbrush you're using? How often you're doing it? And maybe we can give some insights as to if we can say we can improve something you're doing.
Sure.
Maybe somebody at home can get a little insight in that.
You wake up in the morning and brush, and not a consistent flosser. I certainly, just being honest, I probably could take care of my mouth better than I do.
Honesty is key.
It's nice to know somebody in the business, if you will.
What kind of toothbrush are you using? Are you using a regular toothbrush? Are you using an electric toothbrush?
I've recently switched to the electric toothbrush, and it's a big difference, I should say. That and I'm lazy, so it does the word. It does the word for me. I've always been a Crest guy.
Hey, that's what I like to hear.
But I believe there's a Sensodyne, maybe.
Sensodyne,
you know, for the sensitive teeth, sensitive guy.
He cries every once in a while.
I mean, there's so many there's so many products out there. You know, I guess.
So I'm going to give you a little guidance.
Sure.
And I wanted to make sure that I took the time to go through this with everybody, and we'll get you. We'll put together an image for you guys and a graphic to show you all this, and you'll be able to look it up on our website and everything, lombardismiles.com. So what I want you to use, if at all possible, and they make them as inexpensive as $20-$25, is use an electric toothbrush. I like Philips Sonicare, but the Oral-B is still very good. The difference it makes cannot be said enough.
Tell me, I guess, just highlight the most, maybe a point or two. What's the big difference between in your opinion, electric to just a basic?
Well, just the mechanical motion of it. You know, so if you're doing this, or if you're doing this, you're beating up your gums, and you're not cleaning every surface of the tooth. The Sonicare, and I think I've hit on this before, but the Sonicare, it actually doesn't need to touch the where you want to remove the plaque. So the sonic vibrations are going to disrupt the biofilm, the plaque, up to 4 millimeters away from the bristle tip, which is a big deal. You know, if you're talking about such a small area as it is in your back teeth and stuff. But the toothbrush is only half the story. The even more important or equally important side of it is the toothpaste you're using. And one of my pet peeves is that when you pick a toothpaste for whitening purposes. When we see a whitening toothpaste, all that that's doing is removing surface stains.
Sure.
Okay, so we want you brushing with a toothpaste that is actually strengthening the teeth and killing the bacteria in your mouth. And that's going to be a toothpaste that has a stannous fluoride as opposed to sodium fluoride. All right, and now the name brands, we'll put them up for you. Crest Pro Health, Crest Gum Detoxify, Sensodyne Rapid Relief. The difference in that is that the one I like doesn't, it actually kills the bacteria as opposed to stopping their life cycles.
Sure.
So, and it strengthens the tooth more. So if you want to whiten your teeth, you want to use a professional whitening treatment, much like we have with Dazzle Direct. You get your professional whitening trays with your professional prescription grade bleach, and if you use the right toothpaste in concert with that, that's where you're going to get results.
Sure.
The other part of it, and you can use this any time of the day, is using a mouth rinse with fluoride in it.
Fluoride.
You can't, if it doesn't have fluoride in it, you might as well not use it at all. And my favorite one is Listerine Total Care. or Act. It's in a red bottle.
What color is the Listerine Coke here, by the way?
I'm colorblind, but I know it's purple. Yeah. So that's the one you're going to want to use. But just to rein it in, you can look at that stuff online. We'll make sure that's available to you. Any questions you guys have, whether it's related to the dentistry or not, if you want to know a little bit more about golf history and Jack Nicklaus and Tony Jacklin, I can ask Cheese any questions you might have.
Any tips? I was a teaching professional.
He is a great,
not practicing per se, but I do still take care of my friends when needed. So.
Great teacher, and just watching him, I pick up things.
Need a lesson, any help.
But I'm so grateful for our friendship. I'm so grateful for you coming in. Thank you so much, man.
Dom, I'm very proud of what you've done in your life and where you've come from, and it's certainly an honor to be your friend. I mean, there's no doubt about that.
Let's keep getting better, huh?
Absolutely.
Thanks, man.
Thanks.
I appreciate it.
Absolutely.